The CDC and the FDA have paused the one-shot Johnson & Johnson vaccine for an indefinite time while 6 cases of blood clotting and 1 death are being investigated. I spoke with Affinia Healthcare's Chief Medical Officer, Melissa Tepe, about the pause and what the reaction has been amongst those that have received the shot here in St. Louis. So, Doctor, what are the concerns right now amongst most St. Louisans who have received the Johnson & Johnson shot are they at risk of getting sick? Like the CDC has stated 6 cases have been reported, 1 death up to the time. And so what are the concerns? What are you hearing on your side from the medical perspective on this?
Yeah, I think I am glad people are aware. I think the first thing I want folks to know is that this is exactly what the system is set up for, and that the safety system is working. There are 6 cases out of almost 7 million Johnson & Johnson shots. So this is a very, very rare event. We do want folks to be aware so that they can watch for symptoms. But again, this is not something I would say that, most people who got the Johnson & Johnson shot should second guess their decision about that or be worried that this is going to happen to a lot more people. Again, this is very, very rare. We're talking 1 in a million, or even a little less than that. And again, I think that the process is working, right? Even these super, super rare events, we were able to pick up on with our reporting system, which means those of us giving vaccines and those of you getting vaccines are reporting to the CDC and the federal government through the system, which is great. And then also the federal, the FDA and the CDC then did say, hey, we have these 6 cases. We don't know exactly what they mean or if they're related to the vaccine or how, but we're going to put a pause on this vaccine to look at these cases and investigate more thoroughly. And then we'll give our kind of recommendations, and the new information that we're learning will then educate the public and clinicians who are giving vaccine kind of how to proceed. So my biggest takeaway is that the system is working. The Johnson & Johnson is still a very good vaccine. So while we're not giving it now, I don't want folks second guessing their decision to get it. And also, I can see some vaccine hesitancy growing kind of overall because of these cases, but I would encourage us to just take a step back and remember the full story has not been told here. Overall, things are going very well. These vaccines are super, super, super safe. And so I wouldn't let this discourage you from getting the other vaccines that are available, such as Pfizer or Moderna.
Affinia Healthcare, no doubt, has distributed the J&J vaccine. What are you hearing from your own patients? Are they concerned? Are they contacting you? Or are they just kind of also in this holding pattern of waiting to see what happens?
Yeah, so we had administered the Johnson & Johnson vaccine. I will say in the last 2 or 3 weeks, which is kind of what the CDC is looking at, right? These 6 cases all occurred between 6 and 13 days of receiving the vaccine. We had only administered about 14 to 15 Johnson & Johnson vaccines in the last 2 to 3 weeks. So those folks we contacted proactively just to ensure that they were aware of the advisory. And again, to kind of make sure they were aware, but in general, to reassure them. Because again, this is super, super rare, but to give them what to look for. They were all thankful that we reached out, and those individuals did not seem overly concerned, which I think is appropriate. They appeared how they kind of, what I would imagine a normal reaction. The other Johnson & Johnson we gave was much earlier in March. And so those folks are kind of out of the window of these rare blood clot events kind of happening, at least as the 6 reported are historically. So overall, those folks that we contacted seemed very reassured, and we're thankful that we contacted them.
It seems that in all 6 cases, there were women between 18 and 48. Any consideration or any understanding as a doctor as to what could be the problem? What could be the root cause of this?
So I think there's a couple of things to consider. Again, very rare. They were all women of reproductive age. And these are also rare type of blood clots. So a lot of us think of deep venous thrombosis in the leg or pulmonary embolism, a PE in the lung when we think of blood clots. Those are also rare, but more common as far as blood clots go. The 6 that were seen were cerebral venous sinus thrombosis, so in the head, and also accompanied by thrombocytopenia, which means you have low platelets. And so there's kind of a bleeding or coagulopathic thrombophilia component to this as well. So even a rarer type of blood clot. So again, the estrogen that females have in general, in the use of birth control pills or pregnancy, also if folks are in accidents, right, or bedridden, all of these, there are different factors that can put us at increased risk for blood clot. But again, I would say, we are all very comfortable, using birth control pills in many reproductive age women. And the risk of blood clot is higher in that than it is in this vaccine and these 6 rare events that we know of so far. So again, they will parse out some of that data and that investigation of what other types of risk factors or medical conditions did these women have going into this is very important. But again, I think the most important thing is that these events are super, super, super rare. The system is working. We should be investigating that, and that's exactly what's happening. And until we know more, we will pause the J&J, and then we'll wait for more recommendations.
And I guess it's a good moment to talk about just the availability of the vaccine. For weeks, we didn't have it. It was coming, and a lot of people were anxious about getting it. However, there seems to be almost an excess of vaccine in the population now. Tell me a little bit about what Affinia Healthcare is doing to inoculate the residents of the city and county of St. Louis.
Yeah, so we have 2 locations currently where we're using Moderna to vaccinate folks, and we too are starting to see the schedules aren't filling as easily, right? And so I think we will need to do a couple of things, all of us in healthcare. So we have our 2 regular vaccine clinics running. We also are doing outreach activities. So about twice a week, we are doing vaccine events in the community. I think we will need to continue that. And even if it's not, 1,000 doses per day or even 200 doses a day, even if there's small events, we may have to change, right, how we are approaching the vaccine so that we can continue to get to the smaller pockets of folks that still want the vaccine, but possibly have other barriers or were slightly hesitant. Because we are seeing that those folks that wanted the vaccine to start really now have been able to get into the system and access the vaccine through multiple channels now, which is wonderful. So now we will have to individualize our process and our actions so that we can get to smaller pockets of people. And also, I think to start focusing, Pfizer is approved for 16 and over. So to start focusing on those kind of older teenagers so we can get them vaccinated by the end of the school year, right? And going into the summer and next school year.
You just preempted my next and final question. Youngsters are still at a category where they can carry the disease and spread it, considered super spreaders. The news came down from the CDC that 16 and up can receive the vaccine. What are your hopes for 12 to 16, that bracket?
Yeah, so Pfizer has applied for emergency use authorization for the 12 to 15-year-old age group, which is great. They have completed their early studies of that group and have found that the vaccine, very similar to adults, is very effective and very safe. So I think they even said 100% effective in that age group. So I have not heard any specific timeline from the CDC or FDA, but my guess would be that they're hoping to make a decision by early summertime, such that as long as safe and effective, which the data looks like it is, we can really start vaccinating those 12 to 15-year-olds as well before school starts.
And what in your mind as a doctor, as people get vaccinated, there seems to be that people are forgetting to put their masks on or do those social distancing and stuff. What's your take on, what's your recommendation as a doctor to tell folks, you got your shot, but you should do what?
Yeah, so if you got your shot, fantastic, right? I do think we breathe a little easier having the vaccine. It is 95% effective. However, it is not perfect. And when you are out and about outside of your small bubble, you're not sure who's vaccinated and who's not. So the best recommendation is still when you are outside of your bubble, wear your mask, socially distance as the 6 feet as you are best able, and the hand hygiene. Those recommendations have not stopped. And so I would encourage people to continue that. It will just make them safer, and it will also make it safer for everyone around you.
Very final question. Is there anything I haven't asked you that you would like our viewers to know about Affinia Healthcare, your efforts to vaccinate, or the J&J vaccine scare?
Yeah, I think my main takeaway, and thank you for this opportunity really to share the information, is that the system is working. I don't want folks to be scared of the J&J vaccine, although it is paused. We're not giving that now, or the other COVID vaccines. Millions and millions of doses have now been given. The reporting system is working, and they are very, very, very safe. These 6 cases deserve to be looked at, and they are, but they are very, very rare. So in general, educate yourself, but please be reassured that overall the system is working and these vaccines are very safe. And then finally, I would encourage folks to go on to the Affinia Healthcare website, which is affiniahealthcare.org. We have a COVID-19 tab or section, and in that there's actually a link. You can schedule your own COVID vaccine appointment if you still haven't been vaccinated. And we will be having Moderna at one location. Some events are also on the website. And then we've ordered additional Pfizer vaccine from the federal government. And we are starting to make appointments for that as well. Again, hoping to get to that 16 and 17-year-old age group specifically. So if you are in that age group or a parent, please go ahead and log in for your children as well. Hopefully we get our Pfizer vaccine in next week, which would be great. And we are happy to serve the community. Also, telehealth appointments are available if you have questions and want to speak with your physician or clinician about the vaccine, so you can make a great informed choice for yourself.
Doctor, thank you so much for your input and experience and knowledge on this matter. We appreciate your time today.
You're very welcome. Thank you very much.